Hystero means the uterus. Scope is a telescope to look inside. So hysteroscopy basically is a procedure of using a telescope to enter the uterine cavity, both to look for problems inside there and if there are problems to make corrections thereof. There are three kinds of women who will benefit out of a hysteroscopy. Number one, women who are having difficulty in conceiving, and we have to go inside the uterine cavity and see if there is a problem which needs correction so that the woman can conceive easily. Two, if the woman is having menstrual problems like heavy periods or irregular periods which is not being attributed to any other reason or cause. Thirdly, if there is postmenopausal bleeding. So women who've achieved their menopause and are having any kind of spotting or bleeding thereof, we have to go inside the uterine cavity and understand why is that spotting happening and make corrections and make some diagnostic tests. Hysteroscopy is basically used for two kinds of purposes. One, diagnosis, and two, to make any treatment or corrections inside. Hysteroscopy is done inside an operation theatre because we want a sterile environment to be happening around the hysteroscopy. Once you're wheeled into the operation theatre, the nurse or the anesthetist will start an IV channel. Why is the IV channel put? Because we want all the drugs to be given through the IV channel so that you don't have to be injected again and again. The anesthetist then will give you a short drug which puts you to sleep for about, say, 2 to 5 minutes, during which the procedure happens. Once the anesthetist does that and you're comfortable, then we start the process of doing the hysteroscopy. I will be showing you the instruments in a bit while, wherein we attach the telescope to a camera, view it on a screen. The telescope is then inserted through the vagina, through the mouth of the womb. That's a natural passage, so we don't have to make any cuts. Through the natural passage, the telescope moves inside the uterus, and then we view the uterus from the outside. So as I said, hysteroscopy is done under anesthesia, so there is absolutely no pain whatsoever. In the Western countries, hysteroscopy is also done while the patient is still awake, but I think that's a bit discomforting, and because in India anesthesia is cheap, it's effective, and I see no reason why you should endure that kind of pain during the procedure. But just to make you understand that even without anesthesia, as an office hysteroscopy, the procedure can be performed very, very easily. The process of hysteroscopy involves two components, as I said earlier, diagnosis and treatment. Diagnosis takes really about 1.5 to 2 minutes. That's how long it takes for us to enter the uterus and look inside. If at all some treatment is to be done, it depends on what kind of treatment is required to be done inside. So small little procedures like septum corrections, polyp removals really take an additional maybe 2 to 3 minutes, maybe 5 minutes at the most. If there are bigger tumors inside the uterus which need to be removed, then probably an additional 10 to 15 minutes may be required. So all in all, the procedure will take somewhere between 1 minute to at the most 20 minutes. We conduct a lot of training programs for doctors who are budding gynecologists wanting to learn laparoscopy and hysteroscopy, and we always tell them that hysteroscopy takes 1 additional minute or maybe 1.5 minutes to at least look, even if you are not adept or trained enough to do an operative surgery inside. At least you can look inside and diagnose a problem. So if it takes just 1 additional minute, it definitely should accompany every laparoscopy that you do for a woman for any particular cause. Hysteroscopy performing takes about 1 minute. If it's another procedure additionally, it takes another 10 to 15 minutes. You will be with us in the hospital for about 2 to 3 hours. If we've done an extensive procedure like a removal of a fibroid, you'll be staying overnight at the hospital. But that probably is less than 1% of all the hysteroscopies that we do. So for most other procedures, you're going to be with us for just about 2 hours. Once you get released, there is absolutely no bed rest which is required. You can resume your daily activities from that very same day itself. You could experience some bit of spotting or bleeding over the next 2-3 days because we've done procedures inside the uterus, but that's about it. But you could go back to your normal life and exercising from the very same day itself. There are two kinds of procedures which can be performed via a hysteroscopy. One is a diagnosis, two is a treatment. Diagnosis again can happen because of a woman requiring fertility treatment. That woman may be experiencing miscarriages, and that is why some diagnosis has to be made inside. The woman might be experiencing menstrual problems, or the woman might be having postmenopausal bleeding. So in all these cases, some kind of a diagnosis can be made through hysteroscopy. procedure-wise. There could be a polyp inside the uterus which requires a removal. There could be a tumor or a fibroid which is present inside the uterus which requires a removal. There could be a wall or a septum inside the uterus which needs to be cut so that the woman can conceive easily or does not have miscarriages. There could be some infection inside or some lining problem inside the uterus which requires a biopsy for us to be taken. We could be suspecting cancer for that woman, and that is why the lining of the womb needs to be removed from inside the uterus and sent for a diagnostic testing. So all these procedures can be performed via the hysteroscopy. So in a nutshell, hysteroscopy is a very simple office procedure which can both help us diagnose certain problems in a woman, irrespective of what kind of problem she is facing, and also helps us treat that particular problem in the very same sitting as well. So this is what we call a hysteroscope. This is the sheath of the hysteroscope. It has several attachments to it. We have a fluid set here. The essential reason for having a fluid set is the uterine walls are all collapsed against each other. So we need to use a fluid system to open up the walls of the uterus to be able to look inside. Now obviously it's going to be very dark inside the uterine cavity, which is why we have a light cable which shines light inside the uterine cavity and we can see it. The last thing we need, of course, is a camera. So here is a camera system which attaches to the hysteroscope, and through this we're actually able to see on the monitor. You can actually see how my finger looks at magnification. This is a gauge piece, and this is how the gauge piece would be looking in the camera. So through this system is how we look inside the uterine cavity and make corrections if required. But don't worry, this entire system does not go inside the uterine cavity. It's just a small little bit which is actually inside. The entire part does remain outside. And if we need to make some procedures inside the uterine cavity, so say for example, if I have to cut inside, how do we make that cut? So then we have these small little instruments. So this is actually a scissor. This narrow part then passes through this channel, comes out on the other side, and we can actually use these scissors to make corrections inside the uterine cavities. That's how amazing this system is. And because this is only 2.9 millimeters, that is less than 1/3 of a centimeter, it can very naturally and easily glide through the natural passages into the uterine cavity. We don't have to dilate the mouth of the womb. We don't even have to, as I said, give anesthesia if required, although we do give anesthesia. Recovery is also very quick because the channel is so thin. So this is really the world's thinnest hysteroscope.